नमस्कार. आयच्या ह्या खाशेल्या ब्रॉडकास्टात तुमकां सगळ्यांक येवकार. आज आमचे बरोबर एक अशी व्यक्ती आसा, म्हाका दिसता तांकां आयकुपाची पुराय गोंयांक उमळशीक आसतली आनी एक गोंयकार म्हणून आनी ते आज गोंयांत आयल्यात म्हणून तांचो अनुभव, तांचो व्यासंग आनी तांच्या कामाची व्याप्ती येदी व्हडली आसा की म्हाका दिसता गोंयां आसात हाजो दरेका गोंयकाराक अभिमान दिसपाक जाय. आमचे बरोबर आज आसात डॉक्टर डी. नागेश्वर रेड्डी, फाउंडर चेअरमॅन ऑफ एशियन इन्स्टिट्यूट ऑफ गॅस्ट्रोएंट्रोलॉजी आणि सगळ्यात महत्त्वाचे म्हळ्यार पद्मभूषण अवॉर्डी आणि त्याच बरोबर ओनली इंडियन टू बी अवॉर्डेड रुडॉल्फ शिंडलर अवॉर्ड. डॉक्टर, वेलकम टू द स्टुडिओ. माय फर्स्ट क्वेश्चन, how is Goa treating you?
Goa is a fantastic place. I have very fond remembrances. In fact, I came here 30 years back for a conference, and since then I've been here many times, of course, for conferences. So I think the people are very friendly, very warm, and the whole place has got this very holiday type of atmosphere. So you feel very relaxed when you come to Goa.
I read somewhere where you rightly said that a good doctor is 70% aptitude and 30% skill. Now with so many thousands of hours of practice when it comes to your profession, why do you say so, and how do you define the profession, a medical practitioner and a doctor?
No, I think this is very important. Medicine has now become very high tech. You can do a lot of things. For example, we can now change livers, hearts, pancreas. We can do very advanced surgeries even in babies who are still not born. All sorts of things can be technologically done. But the most important thing in medicine still is whether we're doing it for the right indication. In fact, when I was joining medical college, my dad gave me one important advice, that anybody can be a good doctor, but it's important to be a good human being to be a great doctor. And I think that's the difference between a good and a great doctor. So technological skills are one aspect, and I think being a good human being is the other aspect. Then we can apply this in a proper way, because in medicine, empathy is very important. We have to be part of the patient and their family to feel what they're feeling. People think empathy is sympathy. This is not right. Empathy is totally different. We have to be in the shoes of the patient or the relatives, feel what they feel. And 80% of the treatment is still this empathy. It's only 20% which is medicines or surgical skills and so on.
Doctor, you are one of the leading surgeons in the world today. But when I go through your bio, it's a very interesting thing that you're a professor at Andhra Pradesh Health Services. So from teaching to treating, how has been this journey, and then establishing such an institute like AIG? Please tell us about it.
So I graduated in a specialty gastroenterology, which deals mainly with the gastrointestinal tract. That is the stomach, the liver, the pancreas, the small and large intestine. So when I first actually went into this specialty 40 years back, there was very little known about this specialty, because people used to know about cardiology, about neurology and so on, but nobody knew gastroenterology, and everybody thought this was just not so important. But we realized that 30 to 40% of the population is having some gastrointestinal problem, and one day it will become very important. I subspecialized in an area called gastrointestinal endoscopy, where we put small tubes through the mouth or through the rectum and examine the gastrointestinal tract. And we can do all sorts of surgeries through this, remove tumors and so on, which are not possible earlier on. So this came in, and then that's how I specialized into this. I started being a pure professor, not practicing earlier, both in the Andhra Pradesh government and later on the Nizam's Institute. But there was a problem in the sense that I found that in the government service it was very stifling. We couldn't get all the equipment we wanted. We had some very good ideas, but you can't expand because it's very bureaucratic. That's when I decided I should start my own place, so that at least after say 20 years, I can give a good platform for youngsters who can then do all these things without inhibitions. We managed to do that with AIG, built it over, I think now it's almost 20-25 years since we have built these institutions. It has not only become an institution to treat patients, but also a teaching institution. We have DNB students. We have in fact largest number of DNB students in our country, over 45 at a time, whom we are continuously giving super specialty degrees. Teaching them, we have a very large group of very enthusiastic teachers in our institute, who are also very good gastroenterologists. So this combination I was fortunate to achieve, and I couldn't have done this in a government hospital, and that's how I went into a private institute.
Doctor, I also heard that you just don't look at this as a profession but a service, and your endeavor is to take all these medical services to rural areas, and we are a huge country, we are a rural country. How do you do that? And when as you mentioned about technology comes at a cost, and balancing cost with public service and taking it to rural areas. What's your thought process on that?
Yeah, Pramod, you're absolutely right. It's very difficult sometimes to balance the costs of trying to give free service or access to everybody. Right now, the most important deficiency in medicine in our country is not expertise, availability and so on. It is lack of accessibility or equitable care to all the population. 70% of population is still living in villages. They don't have access to care because of either social reasons or monetary reasons. So some years back we decided this is not fair. I mean, you can sit in your city, do great things, but if you're not reaching large population who can't afford or come to a tertiary hospital, then you're not doing it right. So we build these large vans which are like a mini hospital, which contain all this operating equipment, endoscopes and so on. These would go into villages, and then free of cost we do all types of surgeries, very high-tech surgeries in these villages. We started this about 10 years back, and now we have treated more than 2 crore population. Now this has been possible, as you said, the difficulty was how to...
2 crore is a huge number.
Yeah, it's a huge number. But what we did was we had huge amount of donations. I think when people see what you're doing, there's still a lot of people in our country who are willing to donate part of their, what they make for this service. And we got huge amount of donations, not only from industries and so on, but even from common people. When they see what's happening, I remember people who come to me for a consultation, see what's happening, and say, okay, doctor, can I give you 10,000 extra for this scheme for rural patients? And that's how we built on this. So it's been quite a very good experience I found, both in society and in people in the villages who sort of responded so well to this. So when you go to a village, it's a lot of extreme love you get from them. They give us their places to stay, we can sleep there, they give us food for all the people who go there, and then the treatment is done and they're so happy about it. So I think this is very fulfilling, very satisfying for the whole staff in the hospital.
I want to talk about a very crucial aspect, and that's about gastroenteritis as a lifestyle disease, and you have been saying this constantly. And usually when it comes to gastro, that's not at the top of our mind, but when it happens in such a manner that we realize that everything eventually came down to that. How do you explain that gastro as a lifestyle disease? Why lifestyle disease? And what is a general population? What may be 3 or 4 crucial points that we need to keep in mind?
So this is again very important. People immediately think lifestyle means heart or brain and so on. But this is not right. Of course, I am biased as a gastroenterologist. I think the whole center of health is in the gastroenterology system. But it's very clear that our nature actually has created a gastrointestinal system which comes in contact with the food for the first part of the food that in the body comes in contact is the gastrointestinal tract. And the gastrointestinal tract then controls the whole metabolic process, how you process this food, what is the resistance for the insulin in your body and so on. So lifestyles are affecting the gastrointestinal tract, indirectly rest of the health. For example, if you're not exercising well, fat tends to accumulate in the liver, so you develop what is called a fatty liver. This will slowly go into non-alcoholic fatty liver disease and ultimately cirrhosis. Just imagine somebody is not drinking at all, but is not exercising, is become very obese, the liver gets completely damaged, develops cirrhosis equivalent to drinking. So that's a true lifestyle disease. Similarly, the gastrointestinal, if you don't exercise properly or if you're taking too much of alcohol or smoking, then your bacteria in the stomach change markedly. In fact, again, people don't realize this, but our whole body is controlled by bacteria in the gut. This is called the gut microbiome, and there's huge amount of research in that. And when this gut microbiome gets altered because of lack of exercise or unhealthy food habits, then the whole body systems are, the heart is affected, the brain is affected, everything is affected. So that's why I would suggest for healthy lifestyle, adequate exercise is very important. Of course, food in form of high fiber diet, avoiding too much fatty food, more vegetarian based food, again very important. And the other important thing, of course, is use excessive alcoholism should be avoided. I know it's difficult to say this in Goa, but I think this is an important part. And smoking is terrible. Smoking is one of the most important lifestyle dangers that can occur to human beings. So just these 3-4 small, just maintaining this would be.
We are in Goa, and we love our food, we love our drink. And definitely it's very difficult for us to say that we are not going to do it.
Yeah.
So if we are going to do it, how should we do it?
Yeah, so you are right, because in Goa it's very difficult to get away from that. So actually that's the reason why we observed in Goans the incidence of metabolic syndrome is very high. Now what is metabolic syndrome? It's a combination of obesity, hypertension and diabetes. These three when they have, we call it metabolic syndrome. The lifespan of people with this metabolic syndrome comes down. So you'll have to choose whether you want to enjoy your life and die very fast or live a quality longer life. It's very difficult to get away from some of this, especially in a culture like this. But what I'd suggest is that you can keep days off. For example, 6 days a week you follow a good lifestyle, and maybe one day you can have a cheating day, which you can do all these things. This can help to a large extent, but it's very important that excessive of any of these things can give rise to problems. Exercise is very, very important. I think for that there's no excuse even for a Goan. I mean, there's such lovely beaches and nice places where you can exercise. Exercise is very important.
You use the phrase cheating day.
Yeah.
I think most of the Goans would thank you for that phrase. It will be a very, very popular catchphrase probably from tomorrow. And we would all like you to come and settle in Goa, because I think a doctor who gives us that kind of advice, we would love you. We would love you at our heart's content. But Doctor, one very crucial question, and that you also said that medicine is faith-based.
Yeah.
It very, very deep thought, very divine thought, and coming from you, from a world-renowned surgeon like you. Why do you say that?
No, I think this is also very important, that medicine, when patients come to us with faith, they get healed faster. And a very interesting study actually it was done. This was published in the Lancet some time ago, where the patients were given tablets. The same tablet was given by two different doctors. One who was very compassionate, whom the patients had a lot of faith, and the second who was a little arrogant type of doctor. And then patients who took the tablets which are given by this particular doctor, the ulcers healed completely compared to non-healing, same tablets. So you say faith component is very strong, and studies have shown very clearly that faith plays a major role in healing. And another very important study, when there were very sick patients in ICU, and when they were told that they were relatives, everybody was praying for them in the churches or temples or whatever it is, they recovered much faster than those who did not have this type of inputs coming. So there is a big component. The reason why this is important is that the body has got a lot of natural immunity, natural healing process. So in addition to the medicines that we're taking, this natural healing process comes into effect, and faith is where this plays a large role.
One phase now, we can describe our life and probably our world as pre-COVID and post-COVID.
Yeah.
And you have spoken extensively about it, whether even in your institute, there's a independent COVID facility, completely state-of-the-art facility. How do you differentiate a pre-COVID world with a post-COVID world when it comes to our health and our bodies?
I think post-COVID has going to be totally different, in the sense that post-COVID awareness has increased a lot about health and so on. In fact, we have a large paper now showing that the death in COVID patients are more in those who have not only COVID but certain other non-communicable diseases like diabetes, hypertension, obesity. So this emphasizes the role that you should keep perfect health. You may have say hypertension, diabetes, and you think it's okay, but in develop COVID, then that mortality comes because of that. So what I always tell people is that people say, oh, COVID got us, this COVID got us. I tell them also, look at the positive side. COVID has been a great teacher. I think COVID is one of the most important teachers in modern era now. It has taught us the importance of not interfering with nature, being careful and keeping it away. It has taught us the importance of hygiene, immunity and so on, how people should maintain their distances. And most of the hospitals in India now are maintaining these hygiene standards because of COVID. It has also taught us the importance of how funds should be distributed equally. This is very important. It has taught us the importance of vaccine. People never used to discuss vaccination. Now everybody discusses. So all these positive aspects of COVID have to be taken into account. And what I feel is that in the post-COVID era, healthcare is going to change. People are more aware. In fact, one very important observation we found, that before COVID, the insurance rates in our hospital were say like 15%, and post-COVID it's now 30-40% people are insured. People now think health is important, they're starting to get insured and looking at it in a more objective way.
What about post-COVID complications? Because that is now that we are out of second wave, almost 5-6 months post that second wave, that kind of a period we are into, and we don't know enough. Even now, as far as the virus is concerned, we don't know enough. Many people are experiencing many complications now. What kind of patients have you encountered, and what kind of complications we need to be aware about? Because it's all about diagnosis. Finally, we need to know what's happening to us. So, what are those red signals that we need to be aware about?
So again, Pramod, this is a very important point. We did a large study which was published recently. We found that about 30% of the people who actually recover from COVID continue to have various symptoms. The commonest symptom is fatigability. Many of them tell me, I became all right, but I'm feeling very fatigued. I don't feel like doing any work. We don't really understand why this fatigability is still there. A lot of people develop lung problems. They still continue to have difficulty in breathing and so on, and that continues for a long period. What happens to many of these people is now they're starting to develop autoimmune disease. The reason why this happens is the COVID virus produces around 83 autoantibodies in the body, and all these autoantibodies are attacking different organs, thyroid, lungs, arthritis and so on. So they're getting all types of symptoms. So this is present in about 30%. So we have now actually started a whole new outpatient department for post-COVID syndrome patients, and we still are trying to study how to cure these people. But one very optimistic I have to be also about this is now when we started using newer drugs, for example, the monoclonal antibodies. We did a large study published in the Karolinska Institute recently, and what we found is that when we use this in 1,000 patients, not a single patient developed post-COVID syndrome. Just imagine 30% normally, but when you use this cocktail monoclonal antibodies, not a single patient developed post-COVID syndrome. Next, by January, we are going to get 2 oral medicines, one made by Merck, other made by Pfizer. Both of these are going to have the same effect. When you take this medicine, very early on, COVID is going to go off and post-COVID syndrome is not going to come.
So what you are saying effectively, doctor, is that within first week of detecting COVID, these medicines need to be taken.
Within 1 week, if you give them medicine, now we know for monoclonal antibodies because of our study, but soon we are going to get oral drugs also, which can, so I am optimistic that's why that everybody starts talking about third wave. I personally believe that we won't have a big third wave. Third wave won't be there. What is going to happen is that COVID is going to get confined within certain areas like common cold. Is going to become endemic. From pandemic, it's going to become endemic, and that is going to be, that's a very optimistic
advancement
picture.
In medicines and the oral pills is going to make it very less serious.
I think also, Pramod, we have seen, just to add that, what science has done. When COVID started, we knew nothing about this virus. In fact, even in our hospital, we used to have doctors, none of us knew anything about this virus. But it was, we had to go and treat the patients. We knew that we were going to catch the virus and some of us are going to suffer heavy. It was like sending soldiers to war without a gun. But we had to do it, there's no other go. So what we decided is, okay, let's do this. Many of the doctors suffered from COVID, fortunately no deaths, but still as we had to do it. But over the last 1 year or 2 years now, we know everything, the virus, how it comes, how it's spreading, how it's mutating. We're starting to get very powerful drugs. We have definite vaccine, and this is a boon to us. And this is how science has progressed. In 2 years, science has sort of conquered this completely.
Another aspect of technology which I want to talk about is robotic doctors. And your hospital is one of the first in the country to introduce them. It's a scary idea for both. For patients, because when you see a robot treating you, it's a scary thing. For doctors, I think if the robots can do the job of a doctor, then what about the doctor? How do you look at both these aspects?
No, I think a robot is never going to replace a doctor because it doesn't have that human touch. And human touch is still very important in practice of medicine. So what robots do is that they have a precision over long periods of time. For example, if a surgeon was doing one type of surgery and we go on doing the surgery, after some time fatigue comes in, and with the fatigue you tend to make little mistakes. With the robot doesn't occur. So absence of fatigability and consistent precision are the main important aspects. So these robots are going to be useful only for certain types of surgery. In fact, we introduced the world's first flexible endoscopic robot where we are taking patients who had cancers in the stomach, and doing this surgery called ESD, which is to take 8 hours, 9 hours. As an endoscopic surgeon, I used to find that after 4-5 hours, I feel tired. I want to have a cup of coffee, come back. I don't know whether the second part is going to be as good. But with robot, all that is not there now. With equal efficiency, we can go on for 8 hours because it's actually doing it. So it's got its value, but in limited areas. Still, the human touch is very important, and I think that will never go.
Little never. Should the patient be scared seeing a robot operating on him?
No, patients actually like it. I don't know. A lot of patients come and
like
tell
it.
me, yeah. So I tell them, look, this will take me half an hour. I'll do it up. Don't worry. They say, doctor, can a robot do it? Because they think it's superior. So I tell them, look, I have to train the robot. If you want, you can try that.
So you also talk about artificial liver, which is an alternative to liver transplant. Now, liver transplant is a very complicated process also, and in terms of surgery also. How this artificial liver replaces this entire process?
So artificial liver is a concept that's been coming for some years now, and in fact in our basic science department, AIG, we're developing an artificial liver. So what we do is we take the cells from the skin or some other area, and then that we can transform into liver cells now, and then grow the liver cells in plates. What we're now doing finally is to make these liver cells into actual liver, architecture of the liver, and then instead of the actual liver, the artificial liver functions. So this technology, to some extent, we have in fact been successful. We have had about 50 patients treated with this who are surviving for more than 2 years. But I think the finer aspects of technology is going to take another few years, but ultimately it will come. Like we have kidney now, artificial kidney which can do dialysis. We have an artificial heart, artificial liver also is on the way.
The last two questions. One, from Kurnool Medical College to Padma Bhushan, and I believe only third Padma Bhushan in gastroenterology. How does it feel, and how has been this journey?
So this journey, of course, has been one. Of course, hard work is very important, but I think it's been a journey of opportunities, luck, and of course, a lot of help from friends and others. Because I think although I get the final Padma Bhushan, it's actually a lot of teamwork involved. We are a huge team of doctors, nurses, technicians, all are involved in this journey. They all are actively taking part. Of course, the leader gets the credit, but I think all of them actually are responsible. It was initially a lot of difficulty, but once the society recognizes your work, we started getting a lot of donors who helped us with it and so on. And of course, several chief ministers have been we have been very fortunate to get help from several of our chief ministers, like giving us land, helping us with equipment and so on. So there's a lot of luck factor, a lot of opportunities which we grabbed when it came, and predominantly a teamwork which was responsible.
You're saying that the role of a government in recognizing the talent within the state and protecting and allowing it to prosper and supporting it. I think that's very, very important.
Yes.
Doctor, you have spoken about your parents and Dr. Caroline's parents being the role models. How important is it to have your parents as role models? Because in today's lifestyle, we usually tend to ignore so many finer aspects of our life which can set a very model example in front of our children. So what would you like to tell these parents and for us as a society in general?
No, I think this is one of the strengths of Indian culture was this relationship between parents and children. Unfortunately, we are starting to lose this a little. But even now, it's very important because our parents set a model for us, because we are influenced even actually not only directly but indirectly also. If you're looking at your parents, your father or your mother, how they were in terms of behaving with other people, how they were in terms of their work and so on, that influences a lot. So they set the standards, and of course children nowadays, it's difficult to say, they don't always follow, but I think this is a culture that we should maintain with us, because this is extremely important, and they, to a large extent, they have been role models, and these role models are the ones whom you follow to achieve greater things in life.
Doctor, you are on a very, very busy schedule in Goa. Still, you took out time after busy schedule, came to our studio, and we really wanted to do this because a medical practitioner, doctor of your stature coming to our state. We wanted people, our society, Goans at large, to hear your thoughts and hear your opinions. So thanks a lot for taking time out of your busy schedule and coming to your studio. Pleasure talking to you.
Thank you, Pramod.